Dr. Noopur, could you share a bit about your journey and what made you specifically choose this field of oncology, veterinary oncology?
Yeah, sure. So basically, I always wanted to be a vet since I was a child. Both my parents are human doctors, but they were very encouraging with me wanting to be a vet. So there wasn't like a specific instance that I can remember where I was like, okay, this is where I know I wanted to be a vet, but I always wanted to be that. While doing, I finished my BVSc from Shiva, Masters I was doing in surgery from Mumbai Veterinary College, and there we saw a lot of cases with cancer. And while I was trying to research, I realized that we don't have a specialist in India. We don't have a veterinary oncologist who can help us guide pet parents how to treat them. And also realized there were actually a lot of oncologists outside of India, like in the Western world. They have medical oncologists, radiation oncologists and surgical oncologists specifically for pets. So that basically piqued my interest. And then I went to Michigan State for a fellowship in medical oncology, Madison, Wisconsin for a residency in radiation oncology. And then I was an assistant professor at Ohio State for a bit before coming back to India to start an oncology practice.
Oh, so you always wanted to come back to India, and did you feel like that I should be staying in the West?
No, I actually always wanted to come back because
nice.
the goal was to go study and bring it back here.
Okay.
So basically the goal of Cancer Vet is, yes, we want to provide standard of care treatment protocols for cancers in pets. But more importantly, or I would say equally importantly, would be education of the next generation of oncologists. We don't have a structured program in India at this time, and that's what we are trying to do, where we have collaborated with two of my mentors and in the US, one of which is a medical oncologist called Dr. David Whale. There's Dr. Michelle Turek, who's double boarded in medical and radiation oncology. And then a very good friend of mine, Dr. Laura Selnick, who's a surgical oncologist. So basically, we've been working for about more than a year now to structure a program which mimics a Western style residency and advanced training in oncology.
Understanding the signs and symptoms of cancer in pets is crucial. So is early detection and intervention. So what do you think are the red flags that pet owners should be aware of, indicating that they have cancer or on those same lines?
So look, it depends on where the cancer is in the body. There's no one sign that we can look out for. But what I would say is for pets for more than say 8 years of age, it's crucial to pick on these subtle signs that they can give. Maybe they don't want to eat as much, they're more lethargic than usual. Have them checked out. For certain tumors like oral tumors, you might see a big mass in the oral cavity, or if they're limping a lot, it could be something like an osteosarcoma. Coughing a lot, if they are having blood coming from the urine, stool, oral cavity, have them checked out, because while these can be something that's easily fixable, it could still be cancer as well.
So as you said, there are, when the pets are 8-year-old or maybe older, people usually give it that, okay, they are getting old, so if you're lethargy, so you recommend that you should not just take it lightly, just go and get them checked.
Yeah, in fact, I recommend for pets over about 8 years of age to actually go in for chest x-rays, ultrasounds once every 6 months. Have them visit a vet once every 6 months so that you can pick up on these something that is not a huge problem, and with cancer, the earlier we detect it, the better it's going to be. So yes, please don't ignore those subtle signs that your pets would give you, because this is the time when most cancers are detected.
So would you recommend any kind of tests which are like diagnostic in nature, or?
If you're just doing a routine screening to basically as a health checkup, then it's just chest x-rays, abdominal sonography and blood work. But if you're looking at something specific, like if you feel the stomach is bloated, then go in for an ultrasound. If we find that there is a mass present somewhere on the body, just a lump or a bump on the body, then we would do further testing like a fine needle aspirate or a biopsy at that point.
Okay, God forbid a pet is diagnosed with a cancer. So it is a daunting experience both for the pet and for the family. So what do you think are the treatment options available with pets with cancer diagnosis, and how do you approach them, and how accessible they are today?
Yeah, so I think that's a great question, because the minute someone hears
Yeah,
by
the
breast
C
cancer.
word,
I
yeah,
can
yeah.
understand it is very, very scary. There isn't too much information out there, or what the information out there is just maybe too jumbled to actually make sense. But what I can tell you is we can actually cure 50% of the cancers with surgery alone. Okay, so there is hope. Just because it's cancer doesn't mean that that's the end of the road. The treatment options available are very similar to what are available in people. So if there's a mass present, that is surgically resectable. If it's not spread to any other parts of the body, then the first step would be to surgically remove it.
Right.
Chemotherapy is also done in pets, and we actually use a lot of similar drugs that they have in people. So if it is spread to other parts of the body, or for example some cases like lymphoma, which is treated with chemotherapy alone, in that case we would opt for chemotherapy, or to basically prevent spread of a primary tumor, we would go for chemotherapy as well. And then there's radiation therapy. Now radiation, I would say surgery and chemo should be quite easily accessible. But there is a certain way oncosurgeries are done. So whoever's doing the surgery needs to be aware of certain techniques that we would use, or certain normal tissues around the cancer that we would take, so that it doesn't kind of come back. But otherwise, chemotherapy and surgery should be easily available. Radiation, unfortunately, is not as easily available. It is also an expensive therapy. At this point, it's only available in Mumbai.
Okay.
And we have
that too in your clinics, or there are other doctors?
No, so I mean, the other problem is we don't have trained veterinary radiation oncologists. Like, I'm the only trained veterinary radiation oncologist here. So that also kind of restricts where all this can be really done. But just now in Mumbai we have partnered with the hospital to access the radiation units there. Okay. So basically I would finish the radiation protocols as such. But otherwise it's not really easily accessible.
So, for pet parents, you think there are certain breeds that are genetically predisposed to cancer, or it can, I mean, of course it can happen to anyone, but are there some breeds which are?
Yeah, so, I mean, it is a genetic disease in nature, which means, there are certain breeds who are genetically predisposed to cancer. And in India, I think we see a lot of labs, retrievers. They unfortunately do tend to get cancer quite a bit. Beagles, golden, German Shepherds as well. And Indies in themselves also actually, I think, are now getting a lot of cancer. While we don't have numbers or the incidence rate as such, but I've absolutely seen a lot of Indies also get cancer.
So you did mention about a few red flags, but for all those pet parents who have these breeds, you would recommend that they keep a watch and they definitely get those tests done that you recommended. So
yes.
That's Labradors, Retrievers, German Shepherds you mentioned,
German Shepherds, Beagles, even some of the smaller ones like Spitz and all are more prone to getting oral or mammary tumors.
Right.
So all these breeds, and I think actually any pet over the age of 8 should actually be look out for cancer in terms of doing those specific tests on and off.
So do you recommend anything pet parents can do to prevent or avoid this disease in terms of their nutrition, their upkeep? What would you recommend for that?
Yeah, so look, cancer is not preventable in most cases, okay?
Right.
But there are a few things that can absolutely be done. One of the common tumors we see is mammary tumors, so breast cancer in dogs and cats, and this is actually a preventable disease. Yeah, they're spayed when they're before their first heat. So both in dogs and cats, if they're spayed before the first heat, mammary cancer, breast cancer is a preventable disease.
Right.
Second preventable cancer is a lot of times, I think because of the inbreeding that is happening with pets, we've seen a lot of golden retrievers, labs having retained testicles. What that means is the testicles basically don't descend into the scrotum, they stay in the abdominal cavity. And the chances of these turning cancerous are very high. So please get those removed before they get to the 5-6 age, because once it gets, it's really bad. And also there are few other things that you could potentially do. So smoking, secondhand smoking is a risk factor for developing cancers.
Oh, that's interesting.
Yeah, so it is, I mean, obviously the dogs and cats are not going to go and smoke on their own, but if someone in the family is smoking, what happens is those carcinogens sit on the body of the cat who's licking itself, grooming itself. So there's a higher incidence of oral cancer. Or for dogs exposed to smoke, higher incidence of nasal and lung cancer. So if you have to smoke away from
pets,
the
pets. Okay, that's interesting. So for all the smokers, they have to be very careful. Of course around family, but more forward for pets, because I don't think people really think about pets so much.
That they can actually affect them.
Yeah, it's still connected.
It is a risk factor.
So I would go back to your first thing that one of the objectives of going abroad and studying was that you wanted to bring these the education back here in India. So as we look at the future of veterinary oncology, what are some exciting areas of research and innovation you see in that horizon?
Oh, there's actually lots going on right now. It's a very exciting time. In the last, I think, 3 years, 2 new drugs have been approved and commercially available in the US for lymphoma. It's called Lavardia and Tenovia. Another drug called Selfonta is available for mast cell tumors. Now, very specific types of mast cell tumors, but that's available. So every time there's a new drug that is available, what that means for us is it is going to enhance the quality of life and the survival of these pets. Right? So we just have a new tool there. And now a very, I would say, exciting field is immunotherapy. This is when the immune system is kind of ramped up to work against the cancer. So there's a lot of clinical trials going on right now for osteosarcomas, even brain tumors, gliomas, where if we can inject something or give something injectably to ramp up this immune system. There's certain checkpoint inhibitors, these are called, which can basically enhance or improve the quality, not only the quality of life but also the extent of it. In the human world, there are a lot of these drugs that have been approved and they're using now. In the veterinary world now, I think they've approved one of the immunotherapy drugs which would be available very soon. So I do foresee in the next 5 to 10 years there'll be a lot more drugs that are available for our pet patients.
That's great, that's lovely. So in terms of the education bit, I wanted to understand because you said that there aren't many options available for students here who want to study oncology or probably work in this field. So what are the things you and your organization are bringing up those courses, and if yes, then how are people actually going to get in touch with you or do those programs?
Yeah, so at this point we have about 7 people who've joined the program. It's an extensive 3-year program, because it is going to take that or not, if not more, to actually be at least basic knowledge of oncology. So what we are doing is, these are clinicians who have passed them mostly masters, say in surgery, or even graduates who are interested in oncology. So they apply for the program, we take a look at their CVs, and how it works is they will be with us in the clinic, see cases with us, at the same time take lectures. So we have pre-recorded lectures and exams, and we round 2 times a week with the international faculty. What that means is we, for cases which are complicated or which are interesting, 2 times a week we have 2 faculty members who we remotely talk to. So that kind of exposure is also very important. I mean, if there are more people to train someone, the better trained that person is going to be, because there's so many nuances that that I might know that someone else can bring to the table. So I would say this is a really exciting and a very comprehensive training program, which is really a good opportunity. I mean, for me to get into a residency, going abroad was very difficult.
I understand.
So if we can not do that and have something right here, homegrown, with the same kind of quality, I think that's a great opportunity.
So how often do you do this intake of doctors in your program, and what's the way? You have a website, or how does it work?
Yeah, so we do have a website which gives out our email addresses and contact info. A lot of people contact us on LinkedIn as well. So all they can do is just shoot us an email or get in touch with, send us a message, and then we'll get back to them.
Okay, that's great. So my last question here for you is that one advice you would like to give pet parents, and one advice you would like to give budding veterinarians, that what should be they looking at in terms of their careers.
So pet parents, as far as cancers, let me tell you, it is while I understand the diagnosis is very scary, we have a lot of things that can be done. I think there's a lot of fear when it comes to treating anything, cancer in pets, and that's mostly because there's an ethical dilemma of they can't communicate with you if they want to do this, they want to get this done or not, right? So what I will recommend is go talk to an oncologist, because there are so many things that can be done which does not make the quality of life really worse. In fact, they have a pretty good quality of life.
Right.
And the main thing that one of my professors always said is, do not make the treatment worse than the disease. And that's what we follow. That's the philosophy we follow, where we will come up with a treatment protocol that suits the pet based on the age, the disease, where all it's spread. And if that can't be done, we'll ensure that we can keep them comfortable for as long as possible. So don't lose heart if you get a diagnosis of cancer. There are multiple things that can be done.
All right. And to our budding veterinarians,
So look, I would say do what you want to, right? Don't let someone else decide what is the right for you. What is normal for someone may not be normal for you. So go on ahead and decide what is cool at that point may not be the best career decision for you. Right. If you like doing wildlife, go ahead and start working towards that. I feel a lot of young veterinarians are very confused in terms of what they want to do. And I get it, because we don't have that kind of exposure where they could just get up and go follow a wildlife vet. But I would say, don't rush into deciding, okay, this is what I want to do. Take your time, maybe take a year off, follow different vets, see what you would like to do, and then take a decision.
That's actually wonderful. What I have also realized it, everybody is in so much of a hurry to just go and join a clinic and start practicing there. I mean, that's a good thing, but that also means that you need to get a little specialization in that particular field. So that's a very, very relevant advice for them. So doctor, what are the most common type of tumors that are seen in pets, and specifically, is there a difference between dogs and cats, and what are the challenges in treating them?
Yeah, so there are certain breeds who get certain types of tumors, say. In dogs, we do see a lot of mast cell tumors, mammary tumors. Mammary tumors, I think in India, not a very common tumor type in the States, because the pets there are neutered, right? So lymphoma is another common tumor type that we see. Certain breeds, I would say the bigger ones, are more prone to getting something called as an osteosarcoma, so cancer of the bones. We see a lot of oral tumors as well. So these would be some of the common ones seen more in dogs. In cats also in India, we see mammary tumors quite commonly. We do see oral tumors as well, and certain types of lymphomas too. Those would be the common types. So treating pets has its own challenge. One being, what we need to understand is their lifespan overall is about 12 years, right? And most of them get diagnosed at the age of 8 or 9.
Right.
So when we say, okay, look, they're going to probably do quite okay, and the average survival is say 2 to 3 years, we get like, oh, that's it, 2 to 3 years. But what you need to understand is 2 years in a dog's or a cat's life is a lot, right?
Correct,
so the goals also need to rearrange a little. I mean, we are not talking about 5 and 10 year survivals here, because that's not the lifespan we are looking at.
Correct, correct. And also it's a quality of life, I guess.
It's a quality of life also. So that's why the treatments actually are much shorter than people. So for example, the chemotherapy drugs also that we give, or the doses are lesser than what we've given people. The intervals are more than what they're given in people. As for radiation therapy also, the protocols are much shorter, because we do need general anesthesia for them as well. So, these are some unique things going on when you're treating pets as such. And finances, right? I mean, that's it is a huge financial burden to treat with cancer. So I would really recommend the pet parents to start getting insurance now, because it does cover cancer, and it is an expensive therapy, especially if you're looking at something like radiation. It is quite expensive. Luckily, chemotherapy in India, we are using similar drugs as people, and there is generic drugs available, so that doesn't get very expensive.
Right. So, one thing that just came to my mind is that, the prevention part. So, you did mention that, it is important that you either neuter or spay, pets. So, can you, emphasize on the fact, the fact that it's always better to get your pets, neutered or sterilized, because I've seen there are a lot of confusion and a lot of misunderstanding going around, about getting their pets sterilized.
So, honestly, I don't know is the short answer. Okay, because there's newer research coming out every day. There's certain types of tumors they say can increase in neutered pets. There's certain types which are prevented in neutered pets. There's certain limb issues that they start getting if they neuter too soon. So at this point, we really don't know the right age to neuter. And if it is wise to neuter or not. What I can tell you is, mammary tumors in cats is a very, very bad disease. So if it were me, if I had a cat, and I do have a cat, but if I had a female cat, I would neuter her for sure, because I've dealt with mammary tumors and they're horrible in cats. In dogs, I would say they're not as bad, but it's with dogs, I would at least maybe put it as a personal choice, because then they do come up with pretty bad limb issues and all of that as well. So that's the long answer. We don't know the right age or the time to really neuter them at this point.
So I was saying, like other things, it has its pros and cons, but right now the way I see it, it has more pros than cons. Of course, yes, there are pros.
Yeah, absolutely. Especially when it comes to mammary cancer and cats, I would absolutely spay them.
All right. Thank you so much, Dr. Desai, for sharing your expertise and insight with us. It's been a pleasure having you, and I wish you luck with all your endeavors. This is what your third clinic here in the country, or fourth?
So no. So Cancer Vet, we have two clinics. One is in Mumbai, and the other one is in Pune. And Dr. Kasturi, this is the third one. This is Mumbai, Pune, and now Gurgaon.
Thank you so much, and all the best for your future.
Thank you.